when you're undetectable, that means the virus is so low in your body, it can't be detected by blood. That's what our medicines do for us. That's why I've been with my husband now 15 years. He is not HIV positive. None of my kids are HIV positive.
Medications have kept Tori Samuel's HIV at bay for decades. But now, she risks losing access as Florida moves to drastically restrict eligibility for free medication.
They just say it will no longer be eligible to receive health insurance and direct medications. Your insurance cover will end effective March 31st, 2026.
Earlier this year, the state lowered income eligibility from 400% of the federal poverty level to 130%, a change that could impact up to 16,000 residents.
Living with HIV has been like an emotional roller coaster. I first got diagnosed when I was 19 years old. I was pregnant with my first son, and I went to a doctor's appointment. You know, they do the labs and the different testing and everything. And when I came back for the follow-up appointment, that's when the doctor told me, you know, you're HIV positive. Start making y'all some breakfast. Okay. These medications, 130-day supply of Biktarvy, I'm just speaking of what I take, can run between $5,000 to $6,000 a month for a 30-day supply. Who can afford that? My kids need me. If I get down sick or I'm in the hospital, I can't move around, or my immune system starts weakening, how can I be the mother to my twins and help them? How can I be the wife to my husband and be the advocate that I can be for so many people if I'm not healthy? And I think that's one of my biggest fears is like, I look at my kids, I look at my husband, I look at my life and seeing how God has blessed me while I'm taking my medicines, I'm doing great. And that fear of possibly, oh, you may not have access to this come March, that freaks me out. All right, love you. See you when I return.
The Florida Department of Health says the changes are tied to a projected $120 million budget shortfall, but the agency has released few details about the gap.
To me, this is more than me. I'm advocating for the ones that are not able to express themselves for whatever reason. Some people are not out about their status. Some people don't have the means or transportation to advocate. I want to be that voice for the one that can't speak up for themselves. What's the temperature of the room, Michael?
I mean, there's a lot of things happening, some things that I think still are going to be announced today or tomorrow. So,
okay.
But we're getting down to a critical point.
If this goes into effect, my fear is what's next? Are they going to cut other programs? Are they going to cut more medicines from the regimen? We have to continue to stay together as a people and advocate. I don't care if you're living with HIV or you're not. This is not a this person's disease or that person's disease. White, black, old, young, no matter your race, no matter your status, this affects everyone. Make it make because sense. Somebody is not vocally on the forefront saying, hey, I'm HIV positive. You never know who is living with this disease or who has a family member that may be.
Our calls have definitely increased by 100 plus a day.
Yeah.
Why are we even going to go down this road? I mean, because every number is a human being, period.
I wish I could clone you and bring you to Ocala. We got some advocates like speaking out, but a lot of them, they, especially because I'm positive, been positive since 1999, baby.
The AIDS Healthcare Foundation has filed multiple legal challenges, and the effort is drawing bipartisan support from legislators in the state capitol.
What is it that we need to do to try to stop that lapse? Because we're trying to provide the funding, but what else needs to be done? I've never seen anything like this.
If the health department has told the vendor not to pay March's premiums, I don't know which health insurance company out of the goodness of their heart was still covering somebody until maybe July when the budget gets approved and then monies can be backfilled. So I don't know how logistically that gets done.
If people do not have access to their medications, people are not going to be virally suppressed like they are now. The emergency rooms and different things are going to be flooded out. I don't want to see what could possibly happen. Ooh, thank you, Lord. 19-year-old Tori would have never did the things that 43-year-old Tori is doing.
You made it through it. So proud of you. You making a move for the masses, you know. I'm proud of you, and I don't know the 16,000, but I know they behind you because everybody can't jump out there on the front line, but you able to sacrifice yourself and jump out there for the cause. So
to make it up there and to be acknowledged and be able to allow my voice to be spoken and people want to hear what regular people got to say, that it meant a lot to me.
In March, lawmakers approved a plan to restore eligibility and add short-term funding, but it now hinges on whether the governor signs or vetoes it. Even as that plan awaits the governor's decision, emergency rules limiting access are already in effect, leaving patients like Tori in limbo.
I do worry, but I'm not to the point where I'm shook and I'm just going to stop because these budget cuts have went into effect March 1st. No, I'm still going to keep asking questions. I'm still going to keep going to Tallahassee if I need be, whatever I need to do to ensure that nothing else comes into effect. I'm finna whoop them twins up. I'm going to keep going because I have to live for myself. I have to live for my kids. I want to live to be a grandmother one day. I want to live to see my kids get married, go to college, and also to just keep advocating for people like myself to show that you don't have to live in fear. You don't have to live in shame, stigma, that this is not a death sentence. No matter what the future may look like, no matter how uncertain that I am or uncertain that the 16,000 other people here in Florida are, we can't let this defeat us. If anything, this should just mobilize us to come together more, and we have to continue to fight.